This video is for CPAR panel administrators or others using the Attachment Conflict Report, also known as the Panel Conflict Report from the Central Patient Attachment Registry. You received the report as a CSV file and you've opened it in your spreadsheet software. Today I'm using Microsoft Excel. And you may have also taken the filter feature of the software application and applied a filter to the column headers. Let's look at what information's on the report. So each report has a title. It's deemed private and confidential. Please follow your clinic protocol for storing this information. There is a definition of Category 1 and Category 2 conflicts. Category 1 conflict means that more than 30 days apart, the patient was confirmed on the panel at the second clinic compared to yours. Category 2 conflicts means that within 30 days, the patient went to your clinic and said yes to the panel question, and at the other clinic said yes to the panel question as well, all within 30 days. This tells you the date that the report was produced and then the identification. This allows you to identify which panel number it belongs at the clinic, as well as the name that you gave the panel when it was initiated in CPAR. So what's the value of sorting by the conflict category? It allows you to group the ones that took place where over 30 days apart, the patient said yes to the panel question at 2 or more clinics. And then Category 2 is when they said yes to the panel question within 30 days at your clinic and another clinic. The second column on the conflict first reported date would be value for sorting as well, because it allows you to see conflicts that might be, what I use the word lagging. They've been sitting on the report for month after month, and you definitely don't want that to happen, and you want to identify those panel conflicts. The patient ID allows you to identify the patient. If you sort by last name, it would allow you to do a couple things. You could see family members that might all be on the panel, and if you see multiple family members, you'd want to check, did they move or did the whole family switch practices? Also, if a patient's on the report more than once, you'll see them lined up so that you can easily identify that. Sorting by date of birth allows you to see the information by age of the patient. Older patients are much more likely to have chronic conditions, and older patients with multiple primary providers makes it challenging to coordinate their care. So this is a useful piece of information, and the provider whose panel this is might want to see it initially sorted by age of the patient. You're also able to sort it by the date that the patient last was confirmed at your clinic, and somebody clicked that date in the EMR, as well as the date that the patient last visited your clinic. Looking at the conflicting provider data, here you can sort by the provider. If you have multiple patients from your practice that are paneled or said yes to the same provider or to the same facility, you might see that as well. And then you can sort as well by the dates that the patients were confirmed in the EMR at the conflicting clinic and the date that they last visited that clinic. The last column is called conflicting panel status. So CPAR panels can be active or they can be in transition, and you'll see that on this report. An in transition panel would likely represent a provider at the other clinic where they might be on leave of absence, or they may have left or retired from the practice. In that case, the conflicting clinic would have put that panel in transition so that they might be waiting for a new provider to come in and take over the panel or figuring that out. But it is good to know what in transition means. It means that something is going on at the other clinic.